Welcome everybody. Today is an interesting topic. I'm gonna discuss more about ovulation. What are the signs and symptoms of ovulation? I got a lot of questions that how can I know that I'm ovulating? So I thought that I should discuss it today. Stay tuned. If you are new, subscribe to get more of these videos. Now, when I talk about ovulation, we need to understand that ovulation is part of the menstrual cycle, you know. So ovulation is when the mature egg, is released from the ovaries for fertilization now to occur. This differs from cycle to cycle and from woman to woman. Now, what happens? This is because there are those who have a cycle of 35, there are those who have a cycle of 21, and others over 28. So there is a differing of when the egg matures. Now, you need to understand your body so that you can know what are the signs. When you feel like you're not well, you can know that this is ovulation. Now, what are the signs and symptoms of ovulation? Number one is what we call the cervical mucus changes. Now, what happens during ovulation? The body produces the estrogen hormone that makes the cervix to produce the mucus that is stretchy, clear, like egg white. So this is what is produced, mucus, in the cervix. Now, if you want to know that there is mucus production and you test that you know that you are ovulating, what you need to do is you clean your hand, insert the finger, in the cervix, come out with what we call the mucus in your finger. Try to stretch the mucus, between the finger and what we call the thumb. So you realize that it's very stretchy, very stretchy and egg white. So this is a sign that you are more likely to ovulate. Now, the other thing that we need to understand about ovulation is when there is heightened sense. During this time of ovulation, a woman have high sensitive to sense of smell and what we call taste. A woman feels like I don't want to eat this one. I'm smelling something which is not pleasant to me. This one is good. Those cravings, they're more likely that you're gonna ovulate. Now, the other thing is what we call the libido changes. This is what we call the sex drive increases. During ovulation, or near to ovulation, a woman have a desire for sex. She feels like she needs to have a baby and all those things. And this is more likely that she gonna ovulate. So this is a sign and symptom that you need to understand that you are more likely you're gonna ovulate. The other thing is what we call the changes in the cervix. What happens is that normally before ovulation, the cervix is closed and it's lower in the part, and it's what we call stiff or stiffer. But during ovulation, the cervix is soft, wet, and it's open. So these are the changes that just happen in the cervix that makes one to know that she's more likely to ovulate. Now, the other thing that we need to understand is what we call the breast soreness and tenderness. Once you understand your body, you need to realize that there is changes that has happened in my breast. When you feel or when you touch your breast, you feel tender, and the nipple is, pain on the nipple. So you realize that there are changes. So these changes can be more likely due to ovulation. Now, the other thing is what we call the changes in the basal body temperature. Before ovulation, there is a normal body temperature. But Near to ovulation, there is a rise in the temperature, and during ovulation. So you realize that there is a temperature rise. You feel like you are just you have fever. So you need to measure the temperature so that you can realize before. You need to be checking. You be tracking your what you call the body temperature. This is the temperature that you take when you are at rest. So these changes can make one realize that you are near ovulation. Now, the other thing that we need to understand is about what we call the nausea and the headache. You know, near to ovulation or during ovulation, there are just hormonal changes, the estrogen and the progesterone production. This makes one feel like nausea and headache. Now, if you're gonna get these signs and symptoms, you're gonna realize that maybe you are near to ovulate. So you need to monitor your body. The other thing is what we call bloating. You feel like you don't want to eat, or you feel like you are okay. You eat something small, you feel like that you are okay. So these are the signs that you are more likely to ovulate. Now, these are signs and symptoms that you need to understand so that you can know that you are more likely to ovulate. So once you understand this, you're gonna know that you are more likely to ovulate. Now, hope I've answered the question. Thank you. For those who have not subscribed, subscribe. If you like this one, leave a comment.